Or is it Heidi? That's driver. Green button's on, if you're wondering that one too. Again, it also has a button that you can widen the legs. Go right in on the patient. And then you have these black little clips that just slide in right here, and you want to pull down and make sure that, oh, good spot. One thing that I have noticed with the lift is with patients with more soft tissue on their legs, you want to make sure that these are laying flat or they can cut into their soft tissue, or sometimes I'll lay like a towel or just some sort of pad in between the lift and then their legs. And then up here you have to control this piece, and it can go either way, so you're either sitting them up or you're laying them back down. So in order to get on, yeah. Lay back down a little more. And the blue, if you're wondering, is an extra large sling. Perfect size.
Right.
Perfect size for Heidi. And you lift her up there, and then you can move her wherever you need to move her. Ta-da!
Are those slings like per patient?
They are now. And then when you're sitting them down, you just want to make sure that you can get their bottom back in check.
What other colors are there?
There's green, which is, yellow is the smallest, green, let me check, large, and blue is extra large. And if you're looking for the weight limit for your more bariatric patients, you can look underneath the battery pack for the weight limit. And you can put this sling behind a patient who is already sitting up in a chair.
Somebody must also be full weight bearing to be placed in the same frame. This will usually stay down in the gym. I think you can take it bedside, but the steering is rather difficult. This has to be plugged in. There's no battery pack for it. But usually I'll have a patient in a wheelchair because they're not very high level. And so usually I'll get this black strap on before I even get them close, because usually it's pretty much a dependent lift. So Heidi's really mobile, and I'm going to slip it right around her cheeks, really. Really low on her hips if she is one that will slide out, but get it up enough where it's somewhat centered. I always put a gait belt on them too, because sometimes this will slip and she could slide right out. Yep. So I try to get their knees up into the pads as best as possible. The wider wheelchairs, I think, barely fit into this, but we've made it work in more ways than one. So I like to get this little hook facing the outside and as tight as possible. A lot of people I put in this are strips, and so they'll have like a very hemiparetic side. So usually I'll have a second person that will maybe manage the raising and lowering, but also help with an arm to get it up above onto the platform. So I'll do that for Heidi. I'll help her right arm. These have been changed, so now they're actually correct. It used to be that the table height was the picture of the person standing. So now there's an up and down for the sitting and standing. You can also adjust the table height for really tall or really short people. I like this with chest pad right at their chest, and sometimes I'll have people hold on to it. I don't know if that's the right thing to do, but that way they can kind of help pull up a little bit. I'm just going to hit the up button. Somebody will always have a hand on the gate belt, and I'm going to help your right hand up here as we stand, and it might take a while for it to catch because she's a little bitty thing. A long time. So in order for her to get up, she has to use the straps, otherwise nothing will be pulling her up. So they are very, and that's as far as they'll get you. And so I can't move her. She has to stand in one spot. You can do a lot of functional activities. So can somebody give me 2 benefits of using the standing frame? Weight bearing. Blood pressure issues, safety. There's a lot of people I can hear that there's no way I could get them up, but with this they can actually get on their feet. It's good for spinal cord injuries if they will tolerate, for some bone integrity, bowel bladder issues, lots of options. Weight bearing through the shoulder? Weight bearing through the shoulder. Yep, and so I can lower it down because she's hurting there. So, any questions? I think the hardest part is getting it to where you want it to go because it doesn't drive well. There is a brake on this side that comes up and down. Keep it down. So when she goes back down, I'll have somebody hold on to the belts again, and I'll kind of bring this arm. And I'll tell them to try to help it. A lot of times they can't, but it should lower them right back down to the wheelchair. Good? Question?
I just want to add, just be very mindful of people's toes. I've injured a patient before with this because the brake does come on pretty strongly, and if they're not able to control their knee flexion, or it's a lot to get set up, so you're thinking about a lot of different things, but really watch their toes when you walk it because it comes down hard and it hurts real bad.
So the Sara Plus is really easy to use and not used very often.
Can you talk louder?
Yeah, I can. So when you're getting ready to use Sara Plus, you're going to weave the gait belt through these nice little openings here. And then you'll come in, put it around the patient. If you're using the Sara Plus to transfer, you want to make sure that the foot plate is on. Sometimes you can also use this without the foot plate. If you want to very rarely help someone walk with this, you can. It's not really what it's used for, but you can take off the foot plate. Might lift up. And this can be detached. And then reattached. So, use this. It's a 2-person lift. So you'll have the patient sitting up either in their chair, on the side of the bed, and you'll have them lift up their feet. You can place them right there. On this, there's a button that you can widen the legs to get it properly placed. And then you'll come in here, and it's just a little knob, and you'll weave it through the green part. And then you literally just place it in the opening and pull tight here. Got that side. And then these you simply just lift up and then put them down, and then they're locked in place. To take it out, you just lift up and slide through. We'll tell the patient to hold on here. Make sure stand by the patient. You want to make sure that the brakes are locked. And then there's just a button on the controller to lift up. And then wherever you're taking the patient, pull them out, spread them around, and then back to the chair. And then you'll tell the patient to sit with the lift and help make sure she's safely back on the chair.
Melissa, can I ask a question?
Yeah.
My patients tend to just always just kind of do this on that machine. Is it because they don't have enough leg strength?
I think a lot of patients think that when you're using a lift, they don't have to do anything. So I always tell my patients to actively try to stand with the lift. And if they are just kind of hanging here and the sling is coming up, then you might need to look at a different type of lift.
Sometimes I'll get the belt like under their butt a lot more. This purple thing really under their butt, even more like proximal thigh, and you get a lot more success.